reasons why we wanted to call this meeting today is because I think whether you work in the mental health service or you use the mental health service or you know anybody who uses the mental health service, what is clear to everybody is that whilst the papers that come out of the government and the mental health bodies seem to say this is better, we're doing this better, we're greater and greater, the reality for people is that it's getting harder and harder to live your lives and feel in any way sane. And I don't think that's just true for people who are regular users of the mental health service. I think in Britain today, the impact that austerity has and is continuing to have is making every single one of us more stressed on a day-by-day basis and more likely to become mentally ill, and more likely when we get mentally ill to stay mentally ill for longer. Partly because the stress of working your way through the benefit system. I read a very sad story that Alan wrote about someone he was representing, but he's just one of, sadly, I think hundreds of thousands of people who are treated with complete disrespect on a day-by-day basis, not by accident, but actually as a deliberate policy. And I think there is a deliberate policy to, in a way, undo things that in my lifetime I took for granted. After the Second World War, we got a welfare state in Britain, not because they wanted us to have it, but because they knew if they didn't give us it, we would fight back. And we took for granted there'd be a health service when you need it, education, there'd be housing, there'd be legal aid, there'd be benefits if you were sick or disabled. And I think every single bit of that welfare state is now being taken away from us. And I think that's not an accident. That is a deliberate action by the Tories, who never wanted the welfare state in the first place and are using austerity as an excuse to get rid of those things that they don't want, to reintroduce charging, to reintroduce you sort of providing for yourself, depending back on your family and friends, and it being self-reliant rather than state-run. And I think it's not an accident that mental health is the poor relation within that cuts and attacks on the welfare state as well. It has always been the case that mental health is a Cinderella service within the health service. We're 27% of health need and we're 13% of health provision. That's not an accident, and that means we've always had to fight to get basic things for people that often aren't available for them. And I think there have been campaigns amongst those of us who work and use mental health services to fight for better mental health services for a long time, but currently it feels like we're just in defending some of the things that aren't even always the best way, but we have to defend what we've got, and that fight's getting harder and harder. And it is a choice that this government are making. It's not an accident, it is a choice. The money is there if they choose to do it. There is £120 billion of uncollected and evaded taxes that this government could collect. They've made redundant 40,000 tax collectors since this government came in, who could all have been collecting tax. They reckon each one collected £120,000 tax on average compared to their £25,000 salary. And they've sacked 40,000 of them who could be paying for our health service. These are choices that they're making. And the rich get richer. It's not that we're all having equal sacrifice. They reckon the richest 5 families in Britain now own more wealth than the bottom 13 million of us. And that's 5 families and 13 million people. And that's getting bigger on a day-by-day basis. And I think they get away from that with that by attempting to scapegoat and blame us. So instead of blaming the people who are really responsible, they want to blame us for the mess that we're in. So you end up, if you can't get a house at the moment, the reason you can't get a house and you're homeless or you're overcrowded is because some poor soul is living in a house that's got an extra bedroom, and they're the people responsible, rather than the fact that the last 3 or 4 governments haven't built council houses, haven't built enough housing, and it's them who are responsible for homelessness, but they want us to blame the person who's got an extra bedroom. When there isn't enough money for schools and hospitals, instead of blaming the fact that they're letting the rich get away with murder, to be honest, there's easily money to fund it. What they want to do is they want us to blame the scroungers, the people who are claiming an extra bit of benefit. You're all scroungers, you're all skivers. And what was, the people with disabilities have always been discriminated against, but some of the overt anti-disabled sentiment that is now popularly pushed in this country, which is another stress on people who have mental health, as if somehow it's your fault that you're ill, rather than something that happens to people, and it's something that you've got to sort out and do something about. And I think that is how they get away with the horrible attacks on benefits that make people's life much, much more difficult. And I think when you think, it's not a single people with disability who stole £20 billion from our health service. It's not a single migrant worker who has brought the market into the health service, which means it costs us £16 billion extra to sort of work our way through the contracts, the privatisation. People might know that mental health beds in Wythenshawe cost 4 times as much as the NHS beds in North Manchester, and that's why one of the reasons why we've had to close beds in Manchester, and people are often travelling miles and miles and miles in order to find a bed. And it's not migrant workers who did that. In fact, it's migrant workers who've held together our health service over the last 65 years.